Hi, this is Dr. Frez at the Chiropractic Injury Center. Today we're going to be talking about asthma. We have quite a few patients at the office here who suffer with asthma, and most of them are doing the traditional medical therapies. And we do try to kind of act as an adjunct to maybe help them along a little bit, or sometimes quite a bit. There are two things that we need to figure out or find out when we have an asthma sufferer come in. So what we do is when a new patient comes in and that's one of their issues, we do our consultation, we do our exam, and we take some x-rays. And what we're looking for on x-ray, we're usually x-raying the neck and the mid-back, right, from about the eyes to about the mid-chest in through here. And what we're looking for is we want to make sure there's a bone at the base of the neck in between the shoulder blades. And when that bone is where it's supposed to be, there's not a lot of issue. But if that bone moves out of position or subluxates, okay, it can pinch a nerve. And those nerves come around, and that's what innervates or gives power, the signal from the brain, right, to the lungs, so that the lungs can work the way that they're supposed to. So the first thing we want to check is make sure that the bones in between the shoulder blade are where they're supposed to be. Again, if they're not, they could be pinching a nerve, and then the lungs aren't working the way that they should. The second thing that we want to do is we want to check the ribs. All right, the ribs connect into the breastplate in the front here, and then they move back and they connect into the spine in the back. All right, so you have the rib cage. What we notice is when the ribs are in their proper position, the lung is in there, and if the ribs are in place, when the person takes a deep breath in, the lung will expand and it won't get pinched by the rib. What we see though is that those ribs sometimes move or jostle out of position. When they do, and the person takes a deep breath in, now there's not enough space, right, for that lung to completely expand. And that's where the issue is at. So what we do is we go through and we take our adjusting instrument and we adjust each of the ribs. As we put the ribs back into their proper position, now when the person takes a deep breath in, right, there's plenty of room for that for that lung to completely expand. And then when they take a deep breath out, so that it gets that entire process functioning properly. So again, the first thing we want to do is check the bones in between the shoulder blades at the base of the neck. Make sure that none of the nerves, right, the signal from the brain, make sure that those lungs are working properly. And then the second thing we want to do is we want to check those ribs. Make sure that they're in their proper position so that the lung can completely expand and then can completely contract. Right, expand, contract as the person is breathing in and then letting out. This is Dr. Frez at the Chiropractic Injury Center. Thanks for watching.